All righty. So as Heather said, we're going to talk about a healthy heart um, for the tail end of this Healthy Heart Month. We're going to talk about understanding heart disease. It's a high-level look at the different types of heart disease, risk factors that can lead towards heart disease, things to prevent developing heart disease, and then the role, brief touching on education. Then we're going to cover all those questions that were submitted prior to this talk. So this may be really simple, but the heart acts as the pump to get blood from the veins, loaded up with oxygen and nutrients, send it out to the body, and then repeat the cycle over and over again through our lives. Heart disease has significant impacts on quality of life, being able to do the things we want to do. When the heart doesn't work as it should, can limit us with our physical abilities and ultimately can lead to premature death. From a society standpoint, heavy burden on healthcare systems with high costs, lost productivity. There's lots and lots of research going on all the time, looking at ways to prevent these impacts on society and personal health. So the goal is to learn about heart health and ways to improve it. Basic anatomy of the heart. In blue is the venous side, so blood comes in here to the right atrium, gets sent to the right ventricle here, then it goes out into the lungs. The blood then comes back into the left atrium, to the left ventricle, and then out the aorta and to the rest of the body. The coronary arteries supply blood to the muscle of the heart. And then with conditions like heart failure, that affects the muscle walls. Here you see them nice and thick. With heart failure, the heart becomes dilated and just can't pump the way it should. With coronary artery disease, those arteries that blood supply to the heart is limited, so it can't do the work of getting the blood to where it needs to be. So as I said, we have coronary artery disease as the primary condition that we think about when talking about heart disease. Arrhythmias are irregular rhythms of the heart. Tachycardia is when it beats too fast. Bradycardia is when it beats too slow. And then fibrillation is when the coordinated pumping just doesn't work. Atrial fibrillation is what we think about most commonly. That increases risk of stroke. So those folks with atrial fibrillation will start out on blood thinners to reduce the risk of having stroke. And we now have other options, both to get the heart beating correctly and then reduce the risk of having strokes. Heart failure, there's several different kinds, but basically the heart just isn't pumping the way it should. So fluid can back up into the legs, into the lungs, and people are limited in what they can do. Murmurs, people always talk about, well, somebody told me I had a murmur when I was little. There are benign murmurs, things that won't affect the functioning of the heart. Then there are other kinds that that do require attention. And simplest forms of murmur is an abnormal flow of blood through the heart. When the valves aren't functioning correctly, that can cause a murmur that we can hear on exam and then get that patient to the right place to be treated. Risk factors, I broke them up into modifiable and non-modifiable. Modifiable are things that we can control. Smoking is the biggest. If you smoke, please quit. If you don't, please don't start. Diet, we can control what we eat, how we eat, even when we eat. That plays a big role in preventing heart disease. Exercise, again, plays a significant role in preventing heart disease and keeping our hearts strong. Alcohol is probably something we don't think a whole lot about with respect to heart disease, but it does play a significant role. And limiting alcohol intake is very important. Things we can't do much about are our age. As we get older, the risk of heart disease does increase. So as we age, more important to pay attention to those things we can affect. As I mentioned, diet, exercise, and alcohol. Genetics plays a role. If you have a family history of folks having heart disease at a young age, that could be genetic. Men having heart attacks before 50 or 40, that may well be genetic. When that's the case, it's even more important to be aware of your health status and get to your primary care doctor for appropriate screening to catch things early. Along the lines of the preventive measures, a balanced diet, fruits, vegetables, lean meats, and avoiding processed foods. You may have seen the story that came out just today of a large study that looked at ultra-processed foods and the effects it has on our health. So processed foods are things that if you looked at it, you're not really sure what's in it. You know, things that come in a box, things that come in a bag, have significant risks to our health. So eating fresh vegetables, fruits, lean meats are certainly the healthier way to go. A regular exercise helps keep your heart strong and yourself in good shape. That then leads to keeping a healthy weight. When we weigh more than we should, that puts extra strain on our bodies, increases our risk of diabetes, and makes it hard to get back into shape before things start going bad. Stress does play a significant role in our heart health. Stressful situations in the family, at work, all have a negative impact on our health. So regular checkups are critically important to help maintain our heart health. Knowing what your blood pressure is, checking it from time to time at home, certainly seeing your primary care physician to keep it controlled with medication, if that's what you and your physician choose to do. Cholesterol screening. There are some providers that check cholesterol frequently. The current recommendation is that yearly to every even 5 years, if things are stable, is perfectly appropriate. Again, diabetes screening, based on age, based on weight, based on family history, very important to keep an eye on that to reduce your risk of developing diabetes. And this last point is probably the most important, to share with your primary care physician how you're feeling. If you can't walk around Walmart or H-E-B the way you used to without getting short of breath, that should come to the attention of your doctor. If your legs are starting to swell, if you are getting winded doing things you used to be able to do without a problem, your doctor needs to know about that. And obviously, worst case, if you're starting to have chest pain when you're doing the things you used to do without a problem, your doctor needs to know about that so you can have a conversation about how to address it, how to find out exactly what's going on. Smoking and alcohol. As I said, if you smoke, stop. There are lots of um, options to help you quit smoking. For the 1 to 2 pack a day smokers, there's medication, and the patches help. If you're just the occasional smoker, sometimes people can just quit. And I would encourage them to do that. Nicotine gum can be a help as well as a path to help quit smoking. And again, if you don't smoke now, please don't start. The risk of developing heart disease increases dramatically when you smoke. When it comes to alcohol, less is certainly best. For men, 2 drinks a day is currently thought to be acceptable. For women, 1 drink a day. And one thing I always tell my patients is you can't save them up for the weekend. So if you go Monday through Friday without drinking, that doesn't give you permission to drink all 10 on a Saturday evening. It's just 2 drinks a day. So we received several great questions leading up to this talk. So we're going to go through those now. I'm sorry, I got ahead. So how do you lower your LDL? LDL is the bad cholesterol we talk about. HDL is the good cholesterol. So the LDL should be low and the HDL should be as high as you can get it. When it comes to LDL, it's primarily diet and activity, more high fiber foods and healthy fats like omega-3s. Omega-3s are in fish, like salmon or trout, and eating less saturated fats. When it comes to physical activity, the current recommendation is 150 minutes of moderate activity a week. Break that up, 30 minutes a day, 5 days a week. You can get moderate activity with a nice walk. A lot of times folks will say, well, I walk all day at work. It's unlikely, unless you're working in a huge warehouse or digging ditches, that the walking you're doing around your office is enough. Again, LDL is sensitive to weight. So if you can lose a few pounds to get to a healthier weight, that will improve your LDL. Quitting smoking improves it. And then medications, typically statin medications. The brand names you probably know about are Lipitor, Crestor, Zocor, and then the generic names, Torvastatin, Rosuvastatin, Simvastatin. Those medications can help reduce LDL. For patients who have diabetes, the current recommendation is to be on a statin medication. That helps reduce your risk of heart disease. And it's really considered that if you have diabetes, it's the same thing as having heart disease. So it's really important to be on the right medications to reduce your risk. So what's the link between cholesterol and heart disease? Cholesterol contributes to the plaque that gets into those coronary arteries that can cause heart disease, heart attack, and when those blood vessels are clogged in the brain, can cause a stroke. So the way a heart attack works is that those plaques in our coronary arteries can rupture. That cover of that plaque can open up, and then our body reacts to that, like when we cut our finger doing yard work, that clot starts to form, that scab starts to form. When that happens in a coronary artery, that blocks the blood flow, and that's where you get a heart attack. So as I had mentioned, high LDL increases the risk of heart disease. A high HDL lowers that risk. Some people who have a good genetic profile have really high HDLs, and their risk of developing heart disease is very low. By the same token, folks who have very, very high LDLs, I tell them blame your parents, because that's a genetic component that we really need to work on. It's difficult to eat your way to a low LDL when it's really, really high. So we need to protect you using medications. Why does diet matter? In an old computer saying, is garbage in, is garbage out? When it comes to the heart, garbage in, as in eating junk food, it leads to clogged arteries. So as an earlier question addressed, diet has a big impact in cholesterol levels. Foods high in saturated fats, so lard, and trans fats increases your LDL and increases the risk of clogging up your arteries. My wife, as Heather mentioned, is also a physician. One of her sayings to her patients is, if it tastes good, to spit it out. So things with lots of lard, lots of butter, not the greatest for our hearts. Should I focus on lowering my dietary cholesterol or saturated fat? So eliminating saturated fats has a bigger impact than just lowering your cholesterol. So family history is important to heart health because of both genetics and the environment. So we talked about family members, males in particular, dying young of heart disease. It's important to know that so you can actually do something about it before that becomes you. In the environment, what I see often is just bad habits. I grew up in New Mexico eating great Mexican food. The best tortillas are made with lard. Um, refried beans with lard, they're delicious, but they're not good for us. And it's hard to break those habits of eating healthier foods. One thing I hear often is it's expensive to eat healthy. And sometimes, yes, that's true. But how expensive is a heart attack? How expensive is a stroke? Eating fresh vegetables and leaner meats is definitely the healthier way to go. And if you stop smoking, that's a bump in your budget right there. I haven't checked the price of cigarettes lately, but last I heard they were $8 or $9 a pack. You can certainly get some healthy food for that amount of money. So what questions should you ask your family when talking about heart disease? First, about who had it, when they got it. Is there a history of high blood pressure in our family? That can certainly have a genetic component. Who had diabetes? When did they get it? All to find out what you can do to reduce your risk and how urgently you should do that. This was a good question. What can I do if I'm adopted? So the genetic testing is possible to look at your cardiac risk. There's some blood tests that we can do to give us an insight into what your risk may be for developing heart disease. But there again, it all goes back down to regular checkups, doing the best you can with the information you have to eat healthy, be active, stay at a healthy weight, or get to a healthy weight as best you can. Those are all the things that you do have control of to reduce your risk of heart disease. This was another good one. One of the first question we got actually, and I learned this information in preparing this talk. So everybody talks about 10,000 steps a day. That actually came from a marketing campaign from a Japanese pedometer. They just, I guess, liked how it sounded, and it kind of stuck. The evidence, though, is that there's benefit with as little as 5,000 steps, and that benefit increases up to about 7,800 steps. But when it comes to exercise, the more the better. And as we talked about earlier, the recommendation is 150 minutes a week of moderate activity. So feeling like you need to hit those 10,000 steps, that'd be great. But if you can't, just move. All righty, that covers the talk. I'll open it up for questions.